Aerospace medicine. If you are looking for career guidance into aerospace medicine, then today's episode is for you. If you are new to this channel, please subscribe to this channel where I share various tips, tutorial ideas, strategies related to growing your healthcare and medical career. Medical doctor coat or the apron, most commonly known as the medical apron, is the one of the most lucrative uniform, at least in India. And on top of that, the defense uniform, that is Army, Navy or Air Force, is one of the most prestigious uniform. और अगर ये दोनों यूनिफॉर्म आपको एक साथ मिल जाए तो सोने पे सुहागा हो जाए. Hello, my dear friends. Today we are going to talk about a special career, that is aerospace medicine, which provides you benefits of both the career, medical field and the defense field. So, to discuss with that, today we have a special guest with us who is from Air Force. We will connect with them and we'll discuss it in more detail with our guest. Before that, let me introduce that guest to you. He is Wing Commander Dr. Manav Sharma. He is a retired from Air Force as a Wing Commander, and he is a distinguished aerospace medicine expert and a healthcare leader with over more than 22 years of transformative experience in healthcare delivery and aviation safety. He is a veteran of Indian Air Force and he has served more than 21 years specializing in aerospace medicine, aeromedical support, and trauma life support. And he has contributed significantly to the well-being of the air crew and personnel in the diverse operational settings. So Dr. Sharma holds an MBBS from Government Stanley Medical College, Chennai, and MD in Aerospace Medicine from Rajiv Gandhi University of Health Sciences. His leadership roles include heading the Department of Human Engineering at the Institute of Aerospace Medicine, and he has also mentored doctoral candidates with the pioneering innovations like nationally recognized negative pressure patient isolation system. He is a prolific researcher with numerous publications. He has been honored with the prestigious award including Prof. Watt Award and Lieutenant General Billy Moria Challenge Trophy. So now transitioning to the various roles, Dr. Sharma he has poised to leverage his expertise in healthcare management, aviation safety, and strategic health administration to drive impactful change in healthcare operations. With this brief introduction, I welcome you, Dr. Manav, to this special episode.
Hello, Dr. Nitin. It's a pleasure to be here, and thank you so much for having me on your show.
Yeah. So, Doctor, we'll get started with the discussion on the career aspects related to the aviation medicine. So, before that, could you, if you tell us about your career journey or path from medical doctor to this special field of aviation medicine?
Yeah, sure. First of all, thanks for those kind words of introduction. So like you said, I did my medicine from Government Stanley Medical College, Chennai, way back in the year 1999. I finished in 1999. And then I was not ready for a life in a hospital. I sort of wanted to do something different, something more, how should I put it, something offbeat. And therefore, I decided to take up this specialty. But then the specialty didn't happen just like that. So what I decided was that I will not pursue my post-graduation immediately after my MBBS. And then I joined the Army Medical Corps in the blue uniform, which is for the Air Force. And I was commissioned in 2002. And then how the system in the military is that you have to serve for 4 years before you become eligible to do your post-graduation. So I did my 4 years as a GP, as a general duty medical officer. And then after 4 years, I applied for my postgraduate entrance and finished my MD in 2000. And so I joined in 2002, started my MD in 2006 and finished it off in 2009. And then because I did well in my MD, so I was selected to undergo my advanced diploma in aerospace medicine at the United States Air Force School of Aerospace Medicine in Dayton, Ohio, which was in 2013. Before that, I underwent special training in human factors and aircraft accident investigation at an institute called EMASA, which was the French military medical institute in Paris. Apart from that, I also completed my FRCP from the Royal College of Physicians, Edinburgh, in last year. And then over a period of 22 years in the Indian Air Force, Dr. Nitin, I have served in the Kashmir Valley, in Assam, in Rajasthan, down south, and a lot of places in between. And it's been a great ride. It's been a fantastic career, from which I retired last year in June. And then I moved to the United Arab Emirates in July last year. And currently I'm working with a private company as an aviation medicine specialist here in the UAE.
That's a really interesting career journey and definitely inspiring for us. And I think many of our audience would be looking forward towards this career. So to begin with, I have just a very basic question about what is aerospace medicine. We do have some idea, but as an expert, as a veteran from this industry, we would like to know your perspective, how you look at it, and how you can define it as a what is the career as an aerospace medicine.
Sure. So, see, as the name suggests, it's aerospace medicine, right? So it's medicine in the air and in space. I mean, putting it in a nutshell, that's what it is. So what exactly does that mean? See, when you are on terra firma here on Mother Earth, you are subjected to 9.8 meters per second square of acceleration due to gravity, which is standard. We walk, talk, do everything under gravity. Now, when a human being is exposed to the to the atmosphere of the air, I'll come to space later. I'll talk about air first. So there are certain things which happen which affect the human body. Let us say adversely, and the physiological challenges of operating in the air is what we deal with in aviation medicine. If we're looking at aviation medicine, it is what we deal with in the air. So what could that be? Number one, as you ascend, we are all aware that as we ascend, the atmospheric pressure goes down, and therefore, although the percentage of oxygen remains 21% in the atmosphere, however, because of the reducing atmospheric pressure, the amount of oxygen available in the lungs at the level of the alveoli, or at the smallest units of the lung, that pressure constantly keeps going down, and there will come a certain stage where this lack of oxygen will start affecting the performance of the human body adversely. So we call that hypoxia or hypobaric hypoxia, which is hypoxia due to reduced atmospheric pressure. Let's say when an combat aircraft takes a turn, the pilot, or when he's into a dive and he's pulling out of a dive, or a bunch of other things, the pilot is subjected to acceleration which is more than the acceleration due to gravity. We call it G. You must have heard it in somewhere or the other, that 4G, 5G, 6G. Now that itself affects the functioning of the pilot, because at a certain point of time, under gravity, under increased acceleration forces, the blood supply to the brain is going to cease, and the pilot will probably lose consciousness. We call that G-induced loss of consciousness. And then how to handle that? Or going further, let's say the pilot is flying at night, on a dark night, where he has a dark ground below, the sky above. It is very difficult. See, normally when you walk on terra firma, or when you're operating in broad daylight, you see the horizon in front. You have the sky above, the ground below. But when the pilot is operating in a reduced in an environment where the visual cues are reduced, then the pilot is subject to something called spatial disorientation, where he loses track of what the aircraft is doing, what he's doing, whether he's upside down, straight and level. We call that spatial disorientation. Add to that heat stress, vibration stress, noise stress. There are a bunch of things that a human being is subjected to in the air. That's about the aviation, the pilot. Now, passengers who are flying, uh, let's say, Dr. Nitin, you're a doctor yourself. You have a patient who comes to you, says, I have had a myocardial infarction 2 weeks back. I want to go and meet my son who lives in the US. Will you allow the patient to fly or not? Because the reduced pressure even inside a passenger aircraft can adversely affect this person's condition. So all of this comes within the broad purview of aviation medicine. But like we said, the name is now aerospace medicine. So we also talk about astronaut selection, the stresses that the astronauts undergo in space because of the reduced gravity, the bone demineralization, which is loss of the minerals in the bone because of lack of gravity, or the fluid shift which occurs because of the lack of gravity. A bunch of other things, space motion sickness, so many things that happen. Space medicine by itself is a specialized field, and we, as aerospace medicine specialists, we deal both with aviation as well as space. So that's in a brief introduction to aerospace medicine, if you will.
Thank you for putting light into this. So, though it's a like a very, very specialized and very niche field, can you guide us like what kind of educational qualifications or educational requirements are needed for this kind of work?
Of course, Dr. Nathan. So, see, the beauty of aerospace medicine is that, at least in India, aerospace medicine is a regular field of specialization, just like medicine or surgery or pediatrics or gynecology, whatever. It's a regular 3-year MD in India. The thing is that the only university that offers this MD in India is the Rajiv Gandhi University of Health Sciences, Bangalore. So, in today's world, when we appeared for our postgraduate entrance, things were different. But today, you write the regular NEET PG and clear it. And if you're interested in this specialty, you can take up the specialty like anybody else. However, there's a small qualifying aspect to this thing, that there are 10 seats every year in aerospace medicine in India. And the MD is offered, although the degree is given by the university, but the training is done at the Institute of Aerospace Medicine, which is also in Bangalore. Now, since Institute of Aerospace Medicine, or IAM as we call it, IAM is a military unit. It's under the Air Force. Therefore, out of these 10 seats, 7 seats are reserved for military candidates. They could be from any service. They could be from the Army, Navy, Air Force. It just depends what they choose through the NEET PG. And 3 seats are open for civilians. So, educational background, normal MBBS like anybody else, and the training is a regular 3-year MD like any other postgraduate degree that we undergo in India.
Yeah. So it seems like a very competitive field. When it comes to, as you mentioned, like the medical graduate studies, MBBS, is it restricted to only MBBS graduates? On top of that, is there any particular clinical specialty which plays more role in the aviation medicine uh, or which has higher significance?
Yes, definitely, Dr. Nitin. So, number one, to answer your first question, yes, it's only MBBS because like we have in India, to do an MD you need an MBBS. To do a post graduation in any field of medicine, you need an MBBS. So yes, the basic requirement is an MBBS. Uh, the training per se, training in aerospace medicine per se involves a lot of internal medicine, a lot of ophthalmology, ENT, otorhinolaryngology, a lot of orthopedics, a touch of neurosurgery as well. So basically, you kind of become a jack of all trades uh, when you undergo training in aerospace medicine. And as far as the curriculum goes, a lot of the studies are based on physiology. So you need to have a strong base in physiology when you are. I mean, or let me put it this way: you develop a strong base in physiology when you undergo a specialization in aerospace medicine. But eventually, you will end up becoming part ophthalmologist, part ENT specialist, part physician, part orthopedic surgeon.
Okay. So, Doctor, as you mentioned sometime back that we are majorly dealing with the gravity and the atmospheric pressure. So does there any significance for the understanding of the physics, particularly this kind of field?
Oh, well, now that you mention it, yes, there is a little bit of physics involved. See, I'm one of those guys who's terribly scared of physics and mathematics. Uh, I took up medicine, and I thought that I would never have to study medicine and physics and mathematics again. But aerospace medicine, by virtue of being of dealing with aviation and space, yes, there is a lot of physics involved, but it's basic physics. So
Sorry, doctor, I'm not able to hear you.
uh,
Yeah,
okay, shall I
you are
repeat?
audible. Sorry, you are audible.
What I was saying was that yes, people who are in medicine and are scared of medicine of physics and mathematics, they need not worry. There is physics. There's quite a bit of physics, especially when you talk about how an aircraft flies, all the forces that act upon an aircraft, escape velocity, especially when you talk about space medicine, free fall, all that kind of stuff, light, illumination, noise levels, vibration levels. Yes, there is a lot of physics, but it's basic physics, what you would study in class 12, nothing more than that. Not very complicated, easy to you know find a way through it. Nothing very complicated. And I say that as a person who's himself very scared of physics and mathematics. So if I could do it, I'm sure anybody else can do it.
And when we talk about the the completion of the MD in aerospace medicine, do we require any further specialization for uh, uh, particularly working in either space medicine or uh, like that? Do we require special certification?
No, not really, Dr. Nitin. This is like a specialization. This is almost like a super specialization in itself. There is, as of now in India, there is no further specialization in aerospace medicine. However, let me qualify my answer further. There are The basic problem with our degrees back home in India is that they're not recognized internationally. That's a basic challenge that all of us face when we seek to work overseas. And therefore, there is one particular diploma which is offered by King's College London. It's actually a diploma offered by King's College London in aviation medicine, which is internationally recognized. So that's an additional qualification that anybody seeking to work abroad, especially in Europe or America, they probably they might think of having a doing that diploma. But having said that, uh, in a sense, there is no further specialization in this field. People have done their further specializations in related fields. One of my esteemed teachers has done his specialization in human factors from the US. Uh, yes, there are opportunities like that which are available, but you've got to search for them and be very sure of what is it that you exactly want to pursue. DM per se, if you're asking me about a DM degree, no, there isn't any as of now.
Okay. So this field, aerospace medicine, it sounds kind of appears very exciting and very lucrative. So when it comes to day-to-day job responsibilities, can you give us some clarity on that?
Yes, sure. So uh, I practiced aerospace medicine in the Indian Air Force for 15 years. Uh, and I'm not counting my MD as in those 15 years. So, well, let me take you through a typical day of an aviation medicine specialist in the Air Force. So your day starts at 7 in the morning or 7:30 in the morning with the normal, we call it the sick parade, where people come and report sick for whatever they have, uh, I mean, normal running nose, pain abdomen, chest pain, etc., like any other normal OPD. But what is it that an aviation medicine specialist does is we are wholly responsible for handling the medical aspects of the medical side of the aviators, the pilots, the navigators, the flight engineers, uh, all of these, the flight gunners. There's a bunch of these people. They're all in the business of flying. So we handle their problems. So in the sense, for example, uh, if a pilot were to fall sick, he or she would probably come to me, and then because uh, I have a distinct understanding of how uh, that particular condition would affect his or her ability to fly. Number one. Number two, any particular medicine that I prescribe for that ailment, I have a fair understanding of how that medicine can affect that pilot's ability to discharge his or her duty in the air. So that part is completely my baby, so to speak. That I will handle that part for the aircrew. In addition to that, I would also design the emergency response system in case of any aircraft emergency, in case of a crash, in case of an ejection, all of that, what to do, uh, what all equipment I require to react to such an emergency. What is it that the paramedics who are working with me, how do I train them to react to such an emergency? All of that is also within the purview of my duties as an aviation medicine specialist in a squadron. In addition to that, I also I generally am aware in the squadron of what is happening with the flying clothing, the specialized clothing that the pilots use for flying, and this is more in regards to fighter flying than anything else. But the oxygen masks, the G suits, the uh, helmets, all of that stuff, I'm aware, very well aware, and well trained to handle problems associated with the specialized flying equipment. We call it the life support systems. So all of that is also within the purview of my job responsibilities.
So, this area of aerospace medicine, it has much evolved, and there has been a lot of innovations happening and lot of research is going on, particularly related to the space related development. So I wanted to know, apart from this conventional path, are there any additional opportunities or career paths available for maybe this military and commercial or space sector differently?
Yes, Dr. Nitin. So the thing is that the basic training is same for everybody. The basic training in aerospace medicine is same regardless of whether you want to go into civil aviation or you want to go into military aviation or you want to go into space medicine. The basic training remains the same. But the training per se incorporates everything: civil aviation, military aviation, and space medicine. So at the end of 3 years of MD, you are more than well equipped to handle any of these career paths. You could continue in the military, uh, as an aviation medicine specialist, do what I've just discussed. Uh, Go further, go into administrative appointments, so on and so forth. In civil aviation, you could step outside the military and work for any airline. Most of the airlines in India and overseas have aviation medicine specialists on their payroll. Medical departments of most of the airlines, even in India, they're all headed by all renowned, reputed, and exceptional aviation aerospace medicine specialists. So that is another career path that you could choose. And space medicine, well, that is a little bit of a sort of a doozy here, because in India, space medicine is exclusively the purview of ISRO, of the Indian Space Research Organization, which is a government organization. So to get into ISRO, you would have to follow the career, the uh, the ISRO channel, the government channel, and that is as and when ISRO advertises for aviation medicine specialists. Yes, a qualified person can apply and go into that field as well. Uh, Overseas, again, same airlines. Military aviation is a sort of a restricted field overseas because of, for obvious security reasons, you really can't go and join another military that easily. But civil aviation, yes, plenty of opportunities, especially in the Middle East, where our degrees are also recognized. So yes, that is one. And yes, of course, agencies like the European Space Agency, NASA, the Japanese Space Agency, Canadian Space Agency, a bunch of these agencies which have aviation medicine specialists on the payroll. The problem again comes, especially for the other agencies that I've just mentioned. Our degree, our MD degree, is not recognized, so you will probably have to undergo some specialized training or some special qualifications which they recognize, and then you could probably join these agencies, the space agencies specifically.
So, when it comes to this kind of very specialized field, educational requirements, definitely these are the qualifications. But apart from that, to succeed in this industry or this kind of field, uh, what do you think? What are the skills that an individual should possess to kind of excel or succeed in this industry?
Okay, so the skills required to succeed as an aviation or an aerospace medicine specialist, the first and foremost skill, Dr. Nitin, is an inquisitive mind. Uh, an inquisitive mind which seeks challenges, which seeks answers to questions which are not there as of now, answers which aren't available as of now. Why is this happening? Can I make things better for the pilots, for the astronauts? Can I in any way enhance flight safety? And inquisitive nature, why is this particular thing happening inside the, let's say, I'll just give you one example. Let's say a pilot comes to an aviation medicine specialist, let's and says that I have backache, and it becomes worse when I fly. Maybe a week down the line, or 10 days down the line, or a month down the line, another pilot from the same aircraft, not necessarily military, could be civil aircraft, comes and says I have backache. Well, that's too many. And now it is up to me as an aviation medicine specialist to start wondering, why is it that these people flying the same aircraft have the same complaint? Let me go and have a look at the aircraft. Is there something in the seat which is causing this backache? So that inquisitive nature, that the attitude to seek answers to questions. One of my esteemed teachers used to say that you have to look for the wrinkled oranges. You should always search for the wrinkled oranges. Why is this orange wrinkled? And that is what you need to do. That's requirement number one. Requirement number two is the will to do something different. If you are a doctor and you are not happy outside a hospital, then the specialty is not for you, because you will not spend too much time in a clinic in this specialty. You will spend more time interacting with pilots, interacting with other aircrew, finding out what is their problem, finding out ways to solve their problems. And well, that is the, because it's occupational medicine, you have to understand what your clientele is doing all the time. So that is requirement number two. Uh, well, and number three, but last but not the least, you have to be an excellent clinician, because no pilot is going to come to you with his problems, his or her problems of the mask or the G suit or the helmet or backache, unless and until you're able to treat his child and his family well. Uh, you have to develop that bond. You have to develop that rapport with the pilots, with the other aircrew, for them to trust you with their operational problems. First and foremost are your clinical skills. That kind of sums up your requirements to be a good aviation medicine or an aerospace medicine specialist.
Though somebody can have the educational qualification and he can maybe possess the skills also, but still this is a very challenging field or specialty. So, what are the typical or common challenges which are faced by aerospace medicine professionals?
Uh, that's a wonderful question, Dr. Nathan. Uh, Challenges faced by an aviation medicine specialist. The first one is to, like I said when I was talking to you about when I was answering the last question, the challenge is to develop that rapport with the aircrew. That's the biggest challenge you face. Uh, and like I said, how do you sort of break down those barriers? You are an excellent clinician. You have the will to seek answers. You have the will to do something different. And once you've broken down that barrier, the barrier of so-called mistrust, I will not call it mistrust, but it's just one of those things, get to be a part of the squadron, or to be a part of the to be a part of them, so to speak. Once you're there, then you would you will, and I say this with absolute certainty and with personal experience, you will make friendships for a lifetime, stronger bonds than you would ever form with anybody else. You would form those bonds with the pilots of your unit, because once they realize that you're there to uh, help them, you're there to take care of them. You're going to ensure that their careers don't sort of get cut short for something for anything unnecessarily, or something that can be avoided. uh, Once they realize that you have their best interest at heart, then you're there for the rest of your life. You will become a friend for life. You will have friends for life. Okay, that's challenge number one. Challenge number two is striking a very fine balance between medical practice, or the medical science, and operational requirements. So let's say, for example, I'll give you a simple example. Let's say there's a pilot who is scheduled to fly from New Delhi to Toronto. All right, he's an Air India pilot who's scheduled to fly from New Delhi to Toronto. And suddenly, the pilot has a let's say a pain abdomen, or maybe he's got some other problem. Uh, will you allow that pilot to fly? Uh, are you willing to strike that fine balance between uh, you know re- his health and his operational requirement of undertaking that particular flight? That fine balance where you have to take a call whether uh, the risk outweighs the benefits, or whether the benefits outweigh the risk. That thing is what is the most challenging. It is very easy to say, all right, you have a problem, okay, you're offline. But then you have to understand that the organization, uh, maybe it may be military, it may be a civilian organization, they have their own requirements as well. There is a flight that has to be undertaken, there is an operation that has to be undertaken. I cannot have a blanket one size fits all policy that, okay, this happens offline. No, it doesn't work like that. There is a risk assessment that you have to carry out and take a calculated sort of decision as to whether the pilot is fit to fly or not, without compromising on the safety aspects of the operation. So these are the two challenges that you generally face as an aviation medicine, as an aerospace medicine specialist.
Okay. So, Doctor, I'm getting sense that this aerospace medicine is much bigger than just the health of the individual. There are larger implications and very higher impact, and there are more steps rather than just the health of the individual patient. So, this seems a very responsible role. So, could you, like from your perspective, could you tell us how does it differ from the traditional or conventional medical practice? You gave certain examples, but as a clinician point of view, can you add something more into it?
Sure, Dr. Nathan. So I will give you an example. I will answer this question with an example, actually. Now, let me start off by telling you a little bit of theory. In civil aviation, we follow something called a 1% rule. 1% rule is the rule says that the risk of in-flight incapacitation, which means a pilot uh, suffering from incapacitation during the flight, should not be more than 1% in 1 year because of a particular disability. Am I, does this make sense?
Yeah, yeah,
Anything.
got it.
Normally this rule was designed for cardiovascular disabilities initially. But this is the general rule that we follow for almost everything, in at least in civil aviation, that we are looking at not more than a 1% risk for over a period of 1 year of in-flight incapacitation. Now, this is the 1% rule. Now, let's say there is a pilot who comes to me who has had an MI, maybe a month back, and he underwent a PCI, stenting. After that, and is now the pilot thinks that he's fit, and he now wants me to put him back into the cockpit because obviously he was off flying. He was when he had his MI, he was taken off flying for a period of time, and now the pilot says, "I want to get back to flying. Am I fit to fly or not?" Now here's where the challenge lies. I will I will ask the pilot to undergo all kinds of tests. Um, I mean, of course, starting with the basic ECG and then an echo and then a TMT and then maybe a stress MPI, maybe a cardiac CT if required. And given the once I have the results of all of these tests and an opinion of a cardiologist, now it is my responsibility to take a calculated and educated decision about allowing that pilot back into the cockpit. So it is possible that I might say that you are fit to fly, but you cannot fly as captain of the aircraft. You will fly as what we call PIC with QEP, which is pilot in command, uh, with a qualified, experienced pilot. So you can either number one, first option is you go back into the cockpit. Yes, you're fit and fine. You fly wherever you want. Number two is you can fly as captain of the aircraft, but the co-pilot who's there with you, he has to be a qualified, experienced pilot on the same type of aircraft that you are flying. Number three, you cannot fly as captain of the aircraft. You can fly only as co-pilot because the responsibilities of a pilot in command, and those of a co-pilot, they are different in the cockpit. So now the decision that I have to take is where does he fit in, given the fact that I'm not ready to accept more than a 1% chance of in-flight incapacitation over the next 1 year. So does that make any sense? From a clinical perspective.
Yeah, yeah, I got the scenario. So, can I say that it is a like it's a clinical specialty, but it is more of a occupational specialty rather than a core clinical specialty. Can I say that?
Absolutely, Dr. Nathan. That's exactly what it is. This is occupational medicine. This is occupational medicine. That's what it is. Uh, my job is to dovetail my uh, clinical medicine knowledge and expertise into my awareness about the operational requirements, the operational limitations, and the operational stresses. See, how does it make a difference whether a pilot is, if the pilot's cardiologist says that, yeah, you are okay, you have undergone a PCI, and yeah, you go back to the cockpit. No, you have to understand that when he is flying, let's say a 16-hour flight from Delhi to New York or wherever, I mean, and any flight, a long duration flight, he will be exposed to pressure of to an altitude of almost 6 to 8,000 feet inside the cockpit for an extended duration of 14 to 16 hours. Will the this reduced pressure environment, along with the dry air, the lack of humidity, the stresses of flying, uh, will they adversely affect his ability to discharge his duties in the cockpit? That's where I take a call whether the pilot is fit to fly or not, or fit to fly as a captain, fit to fly as a co-pilot only, with a as a pilot in command with qualified experienced pilot, so on and so forth.
Okay, got that. So, apart from these conventional clinical roles and responsibilities, are there any research opportunities or research-related roles available in this field?
Yes, Dr. Nathan, this is a very, very research oriented field. Uh, See, what happens is that there are certain problems which are inherent in flying. Uh, Hypoxia, hypobaria, noise, vibration. Uh, Different aircraft have different noise profiles, have different vibration profiles, have different uh, abilities to, the pressure environment inside the cockpit, inside the cabin, they are different. Uh, Talking about passenger aircraft, now with the low cost airlines coming in, cramped seating, seats that don't recline, uh, we've all gone through that. So all of these things, they are constantly evolving challenges in the field of aviation. uh, Similarly, now with India well on its way to have its own manned space mission in the next few years, the Gaganyaan mission of the Indian Space Research Organization, that has opened up a huge field of opportunity for research, because now we have whatever we've learned till now about space medicine has been either from the West or from limited studies on squadron leader Rakesh Sharma, who was the first Indian astronaut, right? And there hasn't been anybody after him. But now with our own batch of astronauts ready, a couple of them undergoing training abroad, uh, now we have a lot of research going on in our own country on space medicine. So space medicine, the constantly evolving scenario of aviation with different aircraft, different cabin environments, different cockpit environments, uh, the digitization of the cockpit. So earlier it used to be just a stick and a bunch of dials, and you just fly the aircraft purely manually. But today's aeroplanes, they are flown by computers, more by computers than by the human beings. So the how much is the workload? How much uh, is the automation increasing the stress or the workload on the pilot? Is it reducing it, increasing it? Are there any challenges that automation by itself is imposing on the pilot's cognitive abilities? All of that is now open for research. So huge potential for research in this field. So if somebody has a research mindset, well, this is like a gold mine of research opportunities.
Okay. So, definitely, as you mentioned, it's really kind of a holistic field which offers the experience of interpersonal communication skills, your clinical development related skills, and the research opportunities. So let's say somebody, aspirant who have maybe completed MBBS, and maybe they are just willing or they are just looking for this kind of more personalized guidance or maybe related opportunities in this field. They want to learn more how they can prepare for the exams and maybe how to succeed in this industry. So, could you guide us like what could be the best networking opportunity for this kind of aspiring individuals or young professionals?
Yes, Dr. Nitin. So the thing is, networking opportunities. Well, the fact remains, like I said in the very beginning, that 70% of the seats in post graduation are reserved for the military, and the three seats which are open to civilians, they also, because they would be undergoing the post graduation in a military institute, so they would have to sign a bond saying that they will serve in the military for at least one short service commission tenure, which is 5 years, and that's a bond that they have to sign. Well, that holds true for any specialty if you do it through the military, but I'm just saying. So this is a bond that they have to sign. All right. Now, uh, there is if you want to know more about the specialty, what's going on, the kind of research that is happening in the field, uh, interact with professionals in this field, both from civil aviation as well as military aviation. In India, the best place to do this is the annual conference of the Indian Society of Aerospace Medicine. Happens in November, December every year. It is available. Details of that are generally available on the website of the Indian Society of Aerospace Medicine. We call it ISAM. Uh, so if you log on to the just Google, anybody who wants to know more about this can Google Indian Society of Aerospace Medicine. They will come to the ISAM website, and there they will the details and dates of the conference will be available. So if you really want to delve deeper into this, could just register for the conference and take part. 5 days of, 3 days of a complete academic feast, uh, with wonderful networking and interact opportunities to interact with esteemed professionals from this field, and some of the best minds in aerospace medicine in India and the world are a part of this conference. So that's one of the opportunities in India. Other than that, there are two other agencies which you can, if you strive to sort of learn more about the specialty, you could become a member of these two professional societies. One is known as the International Academy of Aviation and Space Medicine, uh, which is uh, another international body which has members from all over the globe. And yes, there you can interact. There's a procedure for getting into into the academy. Not too complicated, but it's doable. And number three is the Aerospace Medical Association, which is based out of the US. Again, you could become a member of the Aerospace Medical Association and then learn more about the activities uh, of the members, and then you can also sort of learn more about the specialty. The Aerospace Medical Association also, dishes out position papers on things like long distance, for example, long distance air travel, long distance commercial air travel, or for that matter, circadian shifts. What we call jet lag. If you're flying from India to the US or vice versa, US to India, the time shift of 10 hours, how is it going to affect your body? What all can you do to sort of tide over that basic problem that either you're feeling sleepy at the wrong time, and you're not able to sleep when it's time to sleep back when you're back at your home base. All of these things. So they dish out position papers as well. And then there is this journal called we call it the Blue Journal. It is called uh, Aerospace Medicine Human Performance, AMHP, which is published by the Aerospace Medical Association. So anybody who wants to sort of see what is happening in the field of aerospace medicine can always log on to the ASMA website, the Aerospace Medical Association website, and see what is happening there. They can access maybe some articles of the journal, which are free, which are open access. Go through what is happening. So these are the basic opportunities that are available.
Sir, you mentioned about the conferences and the professional bodies. Are these open for civilians or it is only for the aerospace sector?
Oh no, Dr. Nitin, they are open to anybody. All you need to do is just go onto the website and register as a member. You could register as a member of the society, right? And if you pursue a career in aviation medicine, then you become an associate fellow and then a fellow of the society, like any other professional body. So it's the same path, even in these professional bodies of aviation medicine. But the thing is that if you want to join these professional bodies, number one, you need to have an interest in aviation or aerospace medicine. Number two, you need to be, uh, I mean, okay, how do I put this? Let's say you are a forensic medicine specialist. What, what would a forensic medicine specialist do in aviation medicine? Although, well, in an aircraft accident investigation, probably a forensic medicine guy would also be involved, but that's a very limited sort of part of the specialty. But yeah, so if you have an interest and you have something, your clinical practice revolves around something to do with aviation, then yes. One very important aspect that has completely slipped my mind was the fact that you could also become an examiner, a class 2 medical examiner for the Directorate General of Civil Aviation in India. For that, you need to undergo some basic training in aviation medicine, and once you've done that, I think the basic requirement is a 2 week course, which used to be conducted by the Institute of Aerospace Medicine only for civilian doctors, and then you can get empaneled with the Directorate General of Civil Aviation as a class 2 medical examiner. So you could also do some initial medicals for not initial medicals. I mean, you could do some, we call them class 2 medicals for a certain group of pilots. You can do those in your clinic or in a hospital or wherever.
Okay. Yeah. So, as we have been discussing so long, it definitely is a very exciting and very lucrative field. So, apart from the roles and responsibilities, also wanted to ask, maybe it's a less significant factor, but still, if you can give certain idea related to the monetary side of this field, like in terms of salary and financial incentives related to this field.
Okay, so Dr. Nitin, well, as long as uh, you're in the military, you get a standard salary which everybody else does, right? And because it's a government organization, so like a lot of it's a central government uh, organization, so you have your basic military pay, you get your non-practicing allowance, like other government agencies give out, and then you get something called a military MSP. It's called the military service pay, which is probably because of the risk that we undertake as military people in uniform. It's a I can't give you a figure, but it's a very decent salary for somebody who's starting out as a doctor. Plus, you have the perks and privileges of housing, basic facilities uh, that are inherent in military life. Your officers' mess, sports facilities, uh, canteen, so on and so forth. All these things that are there. But this is as long as you're in the military. The moment you step outside, or you don't, or you decide not to serve longer, and you want to take up an employment uh, with a uh, with a civil airline or a private agency, well then the field is wide open. uh, you could be working for a small regional airline, or you could be working for a national airline, or you could be working for a global airline. And obviously the salaries and the monetary benefits, they differ across this wide spectrum. I can't really give you a figure to this, but what I can tell you is that the salaries are competitive, uh, generally sufficient, and for anybody to lead a reasonably comfortable life.
So, thank you, sir, for providing this valuable insight. Uh, I do really have many more questions, but due to this limited time span, we maybe will have to stop here. Uh, for the audience, if you have any questions or if you feel that you want to know something in more in detail, please ask your questions in the comment section, and we would be happy to reply to those questions. Uh, and please stay connected with this. Please do share this video with somebody who is preparing or who is looking for more guidance related to aerospace medicine, or maybe just the career opportunities after their medical graduation, that is MBBS. So that's all for now. So I again thank you, Dr. Mano, for your valuable time and the guidance that you have provided through this session. And I look to forward to have another session maybe in future. But till then, what I'll do is I will also link to the conferences or any books or any other resources in the description of this video, which can guide you towards more related to the aviation medicine or aerospace medicine. So you can have a look at those resources. So that's all for now. Uh, I thank you, Dr. Mana, again, and we'll stop here. That's all
Thank
for
you.
now.
Thank
This
you,
is
Dr.
Dr. Nitin, and